Newly released records show the Boars Head deli meat plant linked to that deadly Listeria outbreak repeatedly violated federal regulations. Documents show the plant, it's in Virginia, it had 69 instances of non-compliance just over the past year alone that was flagged by Agriculture Department officials. That includes reports of mold, insects, liquid dripping from ceilings.
Boars Head recalled more than 7 million pounds of deli products last month. According to the CDC, at least 9 people have died. 57 have been hospitalized across 18 states. And South Carolina, we know, is one of those states. We reported earlier this week that 2 low-country deaths have now been linked to that national Listeria outbreak.
This morning, we are joined by Dr. Linda Bell with the State Department of Public Health. Dr. Bell, thank you so much for taking the time to wake up with us and speak with us and our viewers. What can you tell us, really, if anything, about those 2 deaths in the Low Country? Like, what's the process of tracking down specifically how those 2 people got sick?
Well, I can tell you what our process is in general for monitoring for potential public health threats. We have certain conditions that are reportable to public health authorities, and so when we receive an alert like you've just described for this nationwide Listeria outbreak, we monitor for cases by having healthcare providers and laboratories report those cases to the public health department. So this is how we identified the 2 cases that have been associated in South Carolina. We established the association by doing epidemiologic investigations, monitoring for those illnesses with established laboratory tests. We also learned from tracebacks that the manufacturer has issued if there is the likelihood that cases have actually consumed the implicated product.
I have a question, about outstanding risk for people in the area. I know everyone's going to be kind of hesitant to eat, cold cuts going forward now because of this. Are you telling people overall to avoid these types of sandwiches? What is your message for people in South Carolina?
Well, yes, our message is to monitor specifically for these recalled products. So we're not recommending that people just discard all of these deli type meats because the association has only been associated with the specific Boar's Head products. And I do encourage people to go to the USDA website to find out the specific information about the recalled meats because these were produced in a particular facility in Virginia between mid-June and mid-July. Now, even though the recall has been conducted, we really want consumers to be aware because the shelf life of those products is as long as 44 days. So it's possible that people can still have those products in their homes, in their refrigerators, as long as into mid-October. So we're not asking that people discard all deli meats, but to look for those specific products. If they have them in their homes, they should discard them. But another point is that some people may be at increased risk of complications from Listeria infection. So this includes people who are 65 years of age and older, people who may have a weakened immune system, and pregnant women. So for people in those groups, we want them to be particularly cautious and not actually eat other deli meats that are sliced in grocery store facilities because the bacteria can cause contamination on other utensils, other surfaces, and things like that. So people who are at increased risk of complications should take extra precautions about consuming any meats that are actually sliced in those facilities,
Dr. Bell,
in grocery stores.
Pardon me. One of the things that surprised me was just how long those symptoms might take to show up after consuming an infected product. What information can you tell us about the time frame? Say I ate that last week or the week before. For how long should I be looking after myself to make sure that I don't develop those symptoms?
Yes, well, you're correct. It can take a rather long period of time for symptoms to develop. Most people who become infected would develop symptoms within about 2 weeks, but it can be as long as 10 weeks. So we do want people to be aware of potential symptoms, which can include things like body aches, headaches, fatigue, and especially for pregnant women, monitoring for those symptoms because pregnant women can experience complications of pregnancy. So to look for those symptoms if you have consumed those specific products for as long as 10 weeks. But I do want to make the point that most people who become infected, that the illness will run its course. So many people may have mild symptoms. They might not even seek medical care. But for people in those high-risk groups that I've just mentioned, they should monitor for symptoms, and should they experience symptoms, they should consult with a healthcare provider.
Really interesting and important information. Dr. Bell, thank you so much for joining us this morning.
Thank you.